Hello, my name is Dr. John Baton with Urogynecology Associates in Flowood, Mississippi. We are a specialized women's health center that focuses on bladder and bowel dysfunction, as well as pelvic pain, minimally invasive surgery, and hormone therapy. Today, I'd like to talk to you about bladder and bowel dysfunction. Are you someone who is frequently looking for a bathroom and finding yourself having to go to the bathroom more than what you should? Or maybe when you feel the urge to go, you have to run to find a bathroom, or possibly not even make it when you feel like you need to go. Or are you waking up so much at night that it's disrupting your sleep and you find yourself sleepy the next day? What about bowel problems? Do you find yourself when you feel the need to have a bowel movement that you have to urgently find a bathroom and your life kind of revolves around the bathroom? Or maybe you don't make it and you have some accidental bowel leakage. Well, we're here today to talk to you about some advanced therapies that will help you and improve your life, to give you the opportunity to go to a movie, go to dinner with friends, take your grandkids to the park, or maybe even just be able to sit through church. That's what we're here to talk about today. We have a therapy that treats both bladder and bowel dysfunction, one therapy for two disorders that's FDA approved, very simple, easy to do, and provides long-lasting therapy. In fact, up to 80% at 5 years. It doesn't require you to go to the hospital to have any general anesthesia. It's completely reversible. There's no downtime from it or anything like that. And it's been shown to be more effective than medications. It's called InterStim therapy, and it involves gently stimulating the nerves that go from your bladder and your bowel to your brain to help them function more appropriately. Now, there's a lot of people that do these procedures. We're not the only ones. But we're one of the world leaders in this therapy. And in fact, we have people that come all over to us when they're not getting the results that they desire. And so you're not alone with this. There are many millions of people that suffer from this disorder. And in fact, when it comes to overactive bladder, 60% of the people don't even show up for their second appointment. 80% don't show up for their third appointment. And only 3% of people are actually even offered advanced therapy. And then why is this? Well, one reason is patients are very reluctant to talk about this with their physicians, and some physicians are a little uncomfortable either talking about this or treating this condition. But at Urogynecology Associates, that's what we focus on. We focus on these particular disorders. To put things in perspective, 37 million people have overactive bladder. 31 million have asthma, and 29 million have diabetes. Now, when it comes to bladder disorders, there's several different types of bladder disorders. There's two main types, which is stress urinary incontinence, which is where when you laugh, sneeze, cough, exercise, you lose a little bit of urine. This is typically a structural problem that requires a little minor outpatient procedure to fix. Easily done, will correct this problem. The other major type is overactive bladder. It's one where you may have seen the ads on TV, the gotta go, where when you feel the need to go to the bathroom, you're having to run to go to the bathroom, or you're having to go very frequently, you're always looking for a bathroom, or maybe you're waking up a lot at night to go and it's causing you to be sleepy the next day. And some people have it where they don't even make it to the bathroom and they actually have accidents on themselves. That's called overactive bladder, and you don't have to have all those symptoms to be diagnosed with overactive bladder. You can have a combination of those symptoms called mixed urinary incontinence, where you have both stress and overactive bladder together. And there's also a form where people can't empty their bladders well, where they have difficulty voiding. And those people can also have what's called overflow incontinence, where they leak urine because their bladder is not emptying all the way. The InterStim therapy will actually treat both overactive bladder, the incomplete emptying, where you're not emptying your bladder all the way, and part of the mixed incontinence as well. It's not for stress incontinence, that's a separate problem. It has to be addressed in a different way. And it also addresses bowel issues. In fact, 25% of patients who have bladder dysfunction will also have bowel issues. As you remember, we mentioned earlier that over 20 million people suffer from bowel issues. Things such as when you feel like you need to have a bowel movement, you have to run to the bathroom or need to immediately find a restroom, or you don't make it. Some people have feelings that they don't empty their bowels all the way, or they don't completely get done. These things can be very embarrassing and cause anxiety, depression, and just really curtail how you live your life. We're going to offer a therapy for that will make all that better. So what's the solution? How do you treat these? Well, there's what's called care pathways. And with the overactive bladder care pathways, it really involves three things. The first is lifestyle changes. These are simple changes that anybody can do, which involve decreasing your fluid restrictions, avoiding certain foods, doing pelvic floor exercises, or even going to the bathroom at certain times to avoid your bladder becoming overfull and leaking. Now, these help some people, but they don't help everybody, and they don't help people to the extent that they need to be helped most of the time. The next step would be medication. Now, to put that in perspective, 80% of people stop their medication within the first year. Why is that? Well, number one, some of these medications are expensive. Number two, they don't really treat the underlying problem of the disorder, and they can cause side effects such as constipation, dry eyes, heart problems, blood pressure problems, and as people get older, it can actually cause memory problems as well. So sometimes medication either doesn't work very well or is not very good for the patient in their long-term health benefits. And the next line is advanced therapies. Now there's three types of advanced therapies. There's the InterStim therapy, which we're talking about today, which has actually been shown to be superior to medications and actually shown to have 3 times greater improvement in quality of life than medications. There's also injectable therapies such as Botox therapy for the bladder. Now, this works for some people, but it doesn't work for everybody because typically it doesn't work on the underlying cause, which is the communication between the bladder and the brain. Some people do show improvement with Botox, but Botox does require you to have it repeated about every 6 months. And then there's something called posterior tibial nerve stimulation, which involves coming into the office and having a little small needle placed in your ankle, which stimulates the nerve in your ankle that goes back and affects your bladder. Now, this works for some people, but it doesn't work for everybody. And it is very time consuming because you have to come to the office for multiple weeks in a row to have this done. So as we mentioned, the InterStim therapy offers 3 times the improvement over medication, as well as 3 times the improvement in the quality of life. And not only that, the InterStim is a long-lasting therapy with up to 85% improvement, continued improvement at 5 years. So how does it work? The InterStim therapy treats both the bladder and bowel dysfunction by gently stimulating the nerves that go from the bladder and the bowel to the brain. So what happens is, as your bladder fills up, nerves from your bladder that go to your brain send signals telling your brain that your bladder is getting full or your bladder is full and that you need to go to the bathroom. Then your brain sends signals to your bladder to go to the bathroom in the certain appropriate situation. Well, when those nerves become overactive, they send more chaotic signals from your bladder to your brain, and so they can't process it, so you feel like you have to go to the bathroom much more frequently than you should, and it also delays that time from when you feel like you need to go to the bathroom to where your bladder actually releases. Well, the InterStim therapy gently stimulates these nerves and blocks some of those abnormal signals so that your bladder and brain communicate well together. Medicines and Botox, they work on the muscles of the bladder, which in some people does produce some improvement, but overall in the majority of people, it doesn't treat the root cause of the bladder-brain miscommunication like the InterStim does. So how is this done? It's done in a 2-step process. Both stages are very simple. The first step is you get to try a test before you have to actually have the implant placed. The test is a very simple procedure that we do at our outpatient facility that doesn't involve any anesthesia. It doesn't involve any downtime. Most of the time you don't even have to go to the hospital to have it done. There's no major complication, and the test is only 5 to 10 minutes long to do. The test involves simply placing 2 what's called temporary electrodes around what's called the S3 nerve, or the nerve that goes to your bladder, which are located in the 3rd opening of your tailbone. It's a very simple procedure. It simply involves a needle stick, putting the needle in the right place, putting a temporary electrode in there, and removing the needle. Literally only takes 5 to 10 minutes. Now, during the trial, you will walk around with these leads taped down, just attached on the outside. They're not actually in your body permanently or anything like that. And you get to see if you get better from this therapy. You'll keep track of your symptoms before you have the therapy and then after you have the therapy to see if you have improvement. After 5 to 7 days, you'll sit down with your provider and go over your results to see if you had enough improvement to talk about going forward with what's called a permanent implant. Now, the permanent implant is not permanent. It's just a naming issue, meaning it's supposed to be in the body. The temporary electrodes are not meant to be in your body for more than 5 to 7 days, whereas the permanent implant is just a name meaning that it's supposed to be in the body. It's not permanent at all. It's completely reversible. So after you have the test and you have results that you're happy with and show that you've got improvement with the therapy, then we can talk about proceeding with what's called the permanent implant. Again, it's not permanent, it's completely reversible. All it involves is simply placing an electrode that is meant to stay in the body and a small battery to power the electrode. Now this electrode versus the temporary electrode, which just has one little electrode on the end of it, this electrode actually has 4 electrodes and some small little tines to keep this electrode in place. Having 4 different electrodes gives us the opportunity to program this therapy for you. The InterStim therapy is not a one-size-fits-all. It is actually able to be tailored for your specific needs and your specific symptoms. We can adjust it in multiple different ways to fit your needs, not the needs of everybody else, your needs. Again, it's a simple procedure that we do at our outpatient surgery center, not much more involved than actually doing the test itself. There's no general anesthesia, there's no downtime. This device is actually MRI compatible, so you can, if you need MRIs or anything like that, you're more than able to do that. So once you get the implant in, what we'll do is we will see you back afterwards in probably about a week and make sure that you're on the right program. So the good thing about the InterStim permanent implant is we're able to program it for you. Again, it's not a one-size-fits-all. After you have the procedure the same day, we'll pick a program that appears appropriate for you. But we'll see you back in a week and reevaluate that. Now with InterStim therapy, there are 3 keys to this. The first key, number 1, is finding the right patient for it. Number 2 is putting it in the appropriate way. But the biggest key to the success of this therapy is programming, which we're world leaders in programming of InterStim. In fact, we have patients come to see us that have had their device placed other places to come to us to get their device to work appropriate for them. And that's what we do. We actually will follow you through and we will stay with you through this process. We're not going to put something in you and leave you out in the woods with nobody there for you. We're always here for you. We will see you every 3 months to make sure you're doing well, to check your device and make sure everything is going good. And if you ever have any problems or you think you need an adjustment before then, we're always here for you. So to recap, the InterStim therapy is a long-lasting, very effective, easy-to-do procedure, with therapy lasting for 5 years with 85% improvement, continued improvement in patients without the side effects of medication. It's been shown to be more effective than medications with a 3 times greater improvement in quality of life over medication. Well, experience matters. At Urogynecology Associates, we're a world leader in this therapy. If you are someone who suffers from bladder and bowel dysfunction and you're not getting the relief that you need, please come see us for a consultation. If you're someone who's had one of these procedures done somewhere else and you don't think you're getting the maximum benefit of this, please come see us, because not only are we world leaders in placement of the device, we're world leaders in programming of this device, and we see people from all over that come to us and have their device reprogrammed. So again, if you're someone who's suffering from bladder and bowel dysfunctions, please come see us at Urogynecology Associates for a consultation.